All right, so I have this patient. Her name is Marie, and she is a 65-year-old female presenting with low back pain with an insidious onset. She mainly notes primarily having trouble with the radiating of her low back pain and having issues prolonging standing and walking. In order to ease the pain, she has to sit down immediately, and she does report difficulty squatting and lifting heavy weights. She does have to work on her Batmobile, so that's a big one for her and what she cannot do right now. So you will see here in a minute what I have graded her. Hi Marie, my name is Jordan. I'm going to be your therapist today.
Hi, nice to meet you.
Nice to meet you. So you are 65. I was looking at your history and you are coming in for low back pain?
Yes.
Okay, can you tell me where the pain is?
It's in like my right side and it kind of like travels down this way.
Right into where?
Like like into my butt.
Okay, right into your butt? All right, so is there anything that you like doing that you're not able to do anymore?
I can't work on my Batmobile.
You can't work on the Batmobile. Okay, well, let's see how, I'm gonna do an assessment and then we will see how your strength is and let's get you back to working on that Batmobile, okay?
Okay.
Right now, can I have you push up your hip for me? Like turn it all the way up to the ceiling, put your knee. I'm just gonna hold it, and we're gonna go min, mod, max, okay? Because you were able to hold it against that resistance, that would be a 4 and a 5. We can do the other one. Same thing. And we're just gonna go min, mod, max. All right. Okay. Can you put your knee in for me? Like turn it in. Beautiful. Okay. So what I'm gonna do is we're just gonna go with this. I'm gonna push you out. Don't let me. Okay. Okay. Min, mod, max. Okay. And then the other one, let's do the same thing. Read min, mod, max. Okay. Then I have you put it out. I'm gonna push you in. Don't let me. Okay. Okay. Min, mod, max. Then I have you go that way. Good. Min, mod, max. Okay. So what I'm gonna have you do, that would be a 4. So 4 all around for girls' hip strength. I'm gonna have you lay on your stomach for me. We're gonna do some back extensor tests. So are you able to go all the way? Can you put your hands on your head? And I'm gonna stabilize you here. Are you able to go all the way up? No. No? Okay. Can I have you put your hands on the table for me? What about now? Yeah. Okay. Let me see. Go ahead and go up for me. Good. And come down. Awesome. You're able to do that. So that would be a 3 out of 5 for strength. And I'm gonna have you turn around for me. And let's have you put your hands behind your head. Are you able to do like a sit up almost? Or is that no, too hard? Okay. So I'm gonna have you put your hands down here. All right. Go ahead and sit up for me. All right. And that would be a 3 out of 5. That's good. Okay, Marie. I think we have some exercises that we can do for you in order to strengthen all those muscles up. Okay.
All right, Marie, so what we're gonna be doing now is we're gonna be doing some pelvic tilts because your back hurts, and what I'm seeing is you are in more of an anterior pelvic position. So what we're doing is, I know it kind of tickles, huh? So what we're doing is I'm just gonna look for that iliac, right? Look for those spines here on your pelvis. And I'm just gonna show you, so we're tipping it forward like you have, and then tipping it back, okay? And forward, and back, okay? So, this is what I'm using. So I'm gonna have you go here. All right, and so what this exercise is called,
Tilt in supine, or just laying down on your back. So what I'm gonna do is we're gonna have this bolster right here on your neck, so that way then you can start moving your pelvis back and forth. Okay? You're getting used to that. So what I'm gonna do, I'm gonna put this here right here. Okay? There we go. Okay. Get on the table here. Okay. I'm gonna have you.
try to bring that forward for me. Good, and then back. And then forward. Good, and back, and try to tilt your pelvis back a little bit more. Try to push your back like almost into the table, okay? And forward, good, and then back. And then forward, and then back, good. All right, so what I'm gonna The patient was given 4 sets of 4 to do with a green band twice a day, 3 to 4 times a week. At home, the patient uses the rolling pin and the band with a closed door in order to give her resistance. So the next exercise that we're going to be doing is called a cat-cow seated, okay? Because I know when you're in your office chair or when you're really tired, right, you really just like to sit down. That's what alleviates the pain. So what we're going to want to do is we're going to be wanting to take advantage of that and give your spine more of a chance to move, all right? So how we're gonna do this is you're gonna place your feet right on the ground solid, okay? Grab the handles and then you're gonna like just hunch forward, like flex everything forward, okay? And then arch your back as much as you can. As much as you can with no pain. Okay? And as you're doing this, I want you to breathe in on the flex and out, and exhale on the extend, okay?
Okay.
So yeah, in, and breathe in, and then out. Good, extending that spine forward. Good, and then in. Good. And then extending that spine
Forward. So what we're doing here too is we're wanting to see that pelvis go back. Okay, so can you put that pelvis back a little bit for me? There you go. And then in. And then out. Good. Make sure that we're breathing, okay? And then in. And then out. Very good. And go ahead and relax.
So what I would like to see you do is I want that exercise 3 sets of 5 every day or as needed, okay? Especially if you start to feel symptoms. All right, so as soon as you start to feel symptoms, give yourself a rest. Once you feel better, I want you to do that. So then that way we can start getting your spine moving, okay? Hi Marie, how are you doing?
Good, how are you?
I'm good. So how's your pain been?
It's getting better.
Okay, so are we able to start moving on to some harder stuff, do you think?
Yeah.
Awesome. So what I'm gonna do is we're gonna be doing what's called ball marches, okay? So how we're gonna do this is we're gonna be balancing on the ball. What this is working is it's gonna be working that core strength, right? So as you remember when we were first doing that sit-up test, you weren't able to get up without your arms down. So we're gonna be working on your cores today, okay? And this should help your back pain. So you're gonna be going up and down, up and down, okay? And then to make it harder, we're gonna go arm up, touch, arm up, touch, arm up. Okay? Good, now we're gonna wanna make sure that we're sitting up straight here. So go ahead and just do some marching for me. Good. Good. How are you feeling?
Good.
Good. So do you want to make it a little bit harder?
Yeah.
Okay, to make it harder, I'm going to have you take this hand right here, and we're going to bring that to the opposite leg over here, okay? As you bring it up, good, and down, good, up, and down, very nice. So, do you have a medicine ball at home?
Yes.
Okay, so what I'm gonna want you to do is I want you to do something like this at home. I want us to do 8 repetitions of 3, okay? And I want us to do it every 3 days. How does that sound?
Good. I can do that.
Awesome. Okay, now let's move on to the next skill. What we're gonna be doing is we are gonna be on our knees here, okay? I'm gonna have, because you have a medicine ball at home, we're gonna be utilizing that medicine ball. So we are going to put our elbows here. I'm gonna sit up nice and tall for me in that nice kneeling position. And we're gonna be pushing the ball out into a plank and then coming back in slow.
Okay.
What this is doing is it's learning how to control our core. What we don't wanna do is we really wanna make sure that we don't go off to the side here, okay? And twisting. So no twisting, we wanna keep that pelvis nice and straight. We also don't wanna hike up our booty or put our booty so down to the ground, because that's gonna start doing that pelvic tilt that we don't want. So we want a nice neutral pelvis and a nice neutral spine in this, okay?
Okay.
So, and go ahead. Good, keep that core nice and tight, and then come back. Good, and then again. Good. And one more time for me. Good. And come back. Awesome. So how do you feel? Good. Good? Do you feel like that's working? Yeah, it's working? Okay. So what I want you to do at home is 3 sets of 7 every 3 days.
Okay.
Okay? So what we really want to do, especially for those more advanced exercises to get you out of therapy, is we really want to be working on that core to stabilize, so that way it can help your back, okay?
Okay.
Awesome. Any questions for me? Hi Marie, welcome back.
Hi.
How are you doing?
Good.
Good, how's the pain?
It's getting better.
It's getting better? Okay, on a scale of 1 to 10, 10 being the worst.
3.
3? Perfect, let's get you down to a 0, okay? So how we're gonna be doing is we're gonna be strengthening your back muscles, okay? So these back muscles are called erector spinae. And this next exercise I'm gonna show you is gonna really help. Alright, so what I'm gonna show you is I'm gonna have you on this Bosu ball, okay? So you're gonna have your hips and your stomach on it, okay? And when you go up, you're gonna be lifting both your feet and your arms up, okay?
Okay.
To make this a little bit more fun, what we're gonna be doing is we're gonna be tossing up the tennis ball, and I'm gonna catch it,
Okay.
okay? You're gonna be tossing that back to me.
Okay.
Okay. So first I'm gonna double check and make sure that we can do the Superman right. Good. Good position, and 1, 2, 3, up. Good. 2, 4 forward. 2, 4 forward. Yep, adjust yourself. And go ahead, 1, 2, 3, up. Good, and down. Very nice, and 1, 2, 3, up. Good, and down. Awesome, are you ready to try it with the tennis ball?
Yeah.
Go. Okay, ready? 1, 2, 3, up. Awesome, and down. Very nice. Good. 1, 2, 3, up. Good. And down. Good. 1, 2, 3, up. Good, and down. Awesome. All right. Now what I'm gonna want you to do is I'm gonna want you to do, let's do 5 sets of 5, 3 days a week. How does that sound? Does that sound pretty doable?
Yeah.
So what you can do is you can do the same thing. Do you have like on a medicine ball? You can do it on, if you have a Bosu at home, which not a lot of people do. So you can do this on a ball. You can do this on your medicine ball that you have at home, or the yoga ball that you have at home. We can do that. And just get your husband to be there in order so that we can throw it back. What I'm really trying to target with this is, you know how you bend over a lot of time working on that Batmobile and then you stand up? We're trying to get that spine to extend so that way when you do stand up, you can start extending. Okay? How does that sound? Good. Awesome. Okay, so what we're gonna be doing now, Marie, is we're gonna be doing what I call a wall tap. So what you're gonna do is you're gonna do it, doing it in a sitting squat against the wall. The difference between this is you're gonna be playing catch with me.
Okay.
Okay? So what this means is that you are going to sit, like in a wall squat. Thank you. So you're gonna sit like you're in a wall squat. You're gonna catch the ball, but you're not gonna do it like that. You're gonna catch the ball. You're gonna bring it out, tap, bring it back down, nice, slow and controlled, and throw it back, okay?
Okay.
Okay, so what I'm gonna have you do, I'm just gonna check your wall squat. And here, you're gonna have a nice neutral pelvis, so I'm gonna have you squeeze those tummy muscles in and try to keep your back flat up against the wall. Good, right there. And if that's as low as you can go, that's perfect. So now what we're gonna do is I'm gonna throw this to you. Good, out, and then tap slight. Good, and big throw back. Good, tap, big throw back, and last one. Tap, good, and throw back. Perfect. So what I'm gonna have you do is I'm going to let your husband know that he has to do this with you. And I want you to do about, let's do 10 sets of 3.
Okay.
Okay? 10 sets of 3 every 4 days.
Okay.
Okay? Because what we really want to start doing is we want to be looking for a lot of power in that back, right? So we want to be able to actually go and lift up that back, make sure our core muscles are strong, so that way we can actually start bending over and picking things up and doing really nice squats, right? So if that's what you have trouble doing, which is what you were telling me that you were having trouble doing in the beginning, that's what we'll do, is we're gonna be doing some squats and throws. How does that sound?
Sounds good.
Awesome.